Good morning, everyone. Um, so I will be making my presentation on the topic poverty persistence in Nigeria, evidence from household panel data. Um, so I'll try to make it very brief. So hopefully we have time for questions. So poverty still remain quite, the incidence of poverty still remain quite widespread in Nigeria, despite some period of economic growth, but the levels are still quite high. So that is one point. Another very important point is that many households, they remain in poverty not just at a given time, but year in, year out. For these households, poverty persists for them. It's becoming something they live with year in, year out. So this sort of raises an important question, which I think is very important for policy. Why does poverty persist? Why do households remain in poverty over time? So two possible mechanisms could be at play for this outcome. So could it be that poverty persists because poverty today causes poverty tomorrow? That means there's an independent causal link between poverty today and poverty tomorrow. So that is one possible mechanism. A second possible mechanism could be that households are different in their long-term characteristics, which sort of predispose them to poverty. So the important point here, of course, to also make is that although both mechanisms generate the same outcome, so you see a household remaining in poverty over time, they have very different meaning for policy. So in a context like Nigeria, where you have very large population, depending the source, you can get to 30 million to 50 million because there's no census. So a 1 percentage point change in poverty is very significant. You're already talking about 2 million people. So the incidence of poverty is a very big issue in Nigeria. And if we must address poverty in Africa, you need to address poverty in Nigeria. So then addressing this poverty, we need to understand what keeps people in poverty, the mechanism that is at play, so that policy will be properly targeted. Now, to the best of my knowledge, this evidence currently don't exist in the context of Nigeria. There have been a lot of studies that looked at the incidence of poverty, decomposed poverty. A lot of these studies are cross-sectional studies. For you, of course, to be able to answer this kind of question, you need to be able to follow the same household over time. So this is what I try to do in this paper, to isolate the mechanism that is at play why households remain in poverty over time. Now, as I said in the previous slides, there are two possible factors or options or mechanisms that could keep people in poverty. So one is the true state dependence. So this means that poverty today directly increase the risk of poverty tomorrow. So there's an independent causal link between poverty today and poverty tomorrow. So poverty today increases the risk of being poor tomorrow. And this is something we can relate to it, especially in developing country, where household, because of poverty, resort to negative coping mechanisms, like cutting back consumption, withdrawing children from school, selling productive assets. This may provide immediate relief, but what they do is that they create vulnerability over time. So when households withdraw their children from school because they are poor, that sort of eliminates possible productivity in the future. When they start cutting back on essential consumption because they are poor today, that could reduce their health and which can also impact productivity. When they start selling productive assets because there's no social protection and they are poor, assets they could have relied on to live a meaningful life in the future, they also get sold. So this is sort of the idea, and this is the so-called true state dependence. So there's an independent causal relationship between poverty today and poverty in the future. Now, the second mechanism, which is the so-called spurious state dependence. So in this second option, poverty is not a cause, it's a symptom. So households are poor today, not because they were poor yesterday, is because there are long-term, unobserved characteristics predispose them to poverty. So the poverty you see they experience today, it's not like, oh, they are poor today simply because they were poor yesterday. No, poverty is no longer a cause, but it becomes a symptom. So this is sort of the idea around the second mechanism. Now, why are we spending time, or why am I looking at this? Now, because this is important for policy, like I mentioned before. Now, if true state dependence is what we have in the data, and this is the experience, then short-term policies become very viable. So social protection, cash transfer can break the cycle of poverty because you just need to proactively protect households from becoming poor. However, if what we have is spurious dependence, meaning households are poor not simply because they were poor last year, but because their long-term characteristics make them vulnerable to poverty, then policies need to be more structural. Policies need to be more long-term. Short-term policies will not be effective or viable to address the issue of poverty. And I feel this is very important because there's a lot of effort to protect households, to intervene, but those interventions need to be guided by evidence so that they will be effective. So quickly just run through the data. So to do this, like I mentioned before, this is not what you can do with a cross-sectional data. You need to leverage panel data. And the only panel data that will allow you to look at poverty in Nigeria is the General Household Survey. So this is a panel data, a longitudinal data that started in 2010. So far, we have 5 waves. But for this study, I'm using 3 waves, the first, second, and third waves. So after the third wave, there was a refreshment. What it means is that, of course, many households dropped out, so the panel was refreshed. I mean, so from the fourth wave, you have a refreshment. So you really lose that balanced panel strength you had from the beginning. So for this study, is just restricted to the first, second, and third wave. The survey is nationally representative, not state representative, because the sample size is not much. It started with about 5,000 households in 2010. So I use the balance panel, which is about 4,295 households. Attrition is about 9.6%, not so bad if you compare to other surveys in the region that are also longitudinal. You see that the attrition is not very bad. But anyways, as part of the robustness check, I did check how this could affect the results. Okay. So let me start just showing the raw persistence in the data. So here, this is just a pooled OLS regression. Because of space, I didn't show all the covariates, but I have a bunch of covariates here. But what I just wanted to check here is just to show, the point is, if you look at the last column, just to show that there's indeed persistence in the raw data, okay? So poverty at T-1, much higher probability of being poor, okay? So you see that poverty sort of tend to predict poverty. You could see that, okay, that, oh, but like I mentioned, this is just raw persistence. He's suggesting that being poor in the previous period predisposes you to have the higher probability of being poor in the future. But again, the point I made before, raw persistence does not imply causality. Okay, this could be driven by so many factors. So I don't really, I mean, I don't really place so much weight on this result, but it's just sort of like a descriptive to see what is there in the data. Now, so what I try to do is to do something that will help to address the issue of unobserved heterogeneity that could drive the result. So here, I'm not doing anything new, very standard method. So I set up a dynamic random effect probit model. So poverty today depends on poverty yesterday. Then you have a bunch of household characteristics. And very importantly, you have the unobserved household heterogeneity, because this is very important, okay? So in a normal world, I would just go ahead and estimate this dynamic random effect probit model. But there's a problem, and that is the problem of the so-called initial conditions, right? Now, the assumption of the dynamic random effect model is that the unobserved heterogeneity, alpha, in equation 1, so what I have there should not be correlated with the explanatory variables. So that is the standard assumption for dynamic probit model. But the problem is this condition is violated here because of the initial condition problem. Now, let me try and explain this here. So, you know, the initial condition problem, I think in summary, is simply saying, so I observed the household in my data from 2010. But when I started observing them, their poverty state at that time is correlated with unobserved factors like motivation, innate ability, what you cannot see. Now, if that is the case, that means the lag poverty here is also dependent on the initial poverty, Y0. So that also means that YT, so my YT minus 1 here is correlated with alpha, which is the unobserved heterogeneity variable. So what this simply means is that the standard random effect assumption is violated. Well, the good news is there's a solution in the literature. So Woodridge 2005 proposed a very nice way to solve this problem, which is using the conditional maximum likelihood. Again, for the want of space and time, I am not specifying the full equations here, but they are in the paper. So, but the idea is to simply specify the density of the unobserved heterogeneity on the initial poverty, and then a bunch of covariates. So the idea is that this will give rise to a refined unobserved heterogeneity that is not correlated with the initial period. Again, Rab Hesketh and Schroeder 2013 extended this effort. So the only addition they did, because what Woodridge proposed is a little bit restrictive. So what Hesketh and Schroeder did was to sort of extend that by using the covariates at the initial periods. So instead of just throwing in covariates, so you specify unobserved heterogeneity as a function of the initial period and a bunch of covariates, which is somewhat restrictive. So what the augmentation done by Schroeder and co was to throw in covariates at the initial period, which is 2010. So what this allowed me to do when I estimated this model is that it allows me to separate true state dependence from the spurious persistence. Here, just a quick summary of results. So here I estimated the refined dynamic probit model that addresses the problem of the correlation between the initial period and unobserved heterogeneity. So what you see here in the first column, if you look at, so if you don't address the problem of unobserved heterogeneity and the initial condition, you have the output in question 1. There you will see that there is persistence in the data. Okay? However, if you move to the second column where you address unobserved heterogeneity and initial condition, you see that this persistence disappears. So what this means is that, which again I tried to explain in the next slide, is that the persistence we see in the data is actually not real. It's spurious. The moment you control for initial condition problem and household unobserved heterogeneity, that difference disappears. It doesn't hold in the data. So what we saw in the raw data, what we saw in the dynamic model that doesn't control for unobserved heterogeneity and initial condition problem, is not causal. Now, I'm running because of my time. Now, so after accounting for unobserved heterogeneity and initial condition, what do we see? We don't see evidence of true state dependence. We don't see. So what this means is that past poverty does not causally increase future poverty. There's persistence in the data, yes, but it's not causal. Now, what it means for in terms of interpretation is that the poverty persistence we see in the data is spurious. And like I mentioned at the beginning, that means the persistence is driven by enduring household characteristics, life choices, structural constraints like opportunities, motivation, innate ability, things that are more structural than just falling into poverty. And I think this is something, of course, to keep in mind. So I'll quickly run before my... so here again, I just looked at the correlates of poverty persistence. The usual suspects are all here. Then here, I looked at poverty dynamics. Sorry, take a picture. Okay. So here I looked at poverty dynamics. So here, okay, Matt. So what I did here is just to take the estimate from the dynamic model and just look at entry, exit, persistence, and steady state. Again, the usual suspects, nothing. Here again, let me just go to, I did a bunch of robustness check. Attrition is not a problem. I check for balance versus unbalance. I use inverse probability weighting. I did a split of the sample. Main conclusion remain unchanged. Nothing changed. Now, okay. So in terms of policy implication, short-term poverty alleviation alone is not enough. I guess this is my key message. Short-term intervention alone is not enough because the persistence is not causal. It's structural, okay? We need to look at structural intervention for Nigeria, combining them, of course, with short-term intervention that are important. I say it's important because short-term intervention could mean that woman in the village will not go to bed without food. So it's still very important. But the problem is deep, it's structural. So we need a structural intervention. So yeah, I think I will stop here because I've already been told my time is up. Thank you very much.
I think we do need to know more about how you control for initial conditions. And my other question is, why model poverty as opposed to the underlying variable consumption, perhaps with some distributionally sensitive approach? You have more variability in that.
Thanks, Professor Andy. So for the Y measure, so I guess I could have also considered looking at consumption as an outcome, but the way I set up the model and the analysis I had in mind, I felt, and when I looked at the literature where previous studies was done, they sort of use a binary outcome instead of the consumption. But I think it's definitely something that is worth considering as well as an additional analysis. But quickly to your first question, how did I address initial condition? So there, because There's a standard way because I didn't reinvent the wheel here. So Woodridge in a 2005 paper proposed a very nice and simple way. Is to estimate directly unobserved heterogeneity as a function of the initial poverty period and the covariates. So a bunch of household characteristics. But like I mentioned before, that solves the problem, but it's somewhat restrictive. That was why I augmented that approach. The only difference or the only augmentation I did was to include not just household characteristics, but household characteristics at the initial period. So that provided some flexibility. So once you run that estimation, you get a new unobserved heterogeneity that is not correlated with the initial period. So that was exactly what I did.
Looking at the household characteristics, which of the characteristics predict poverty?
Yeah, yeah. No, sorry. I started moving very quickly at that point. So quite the usual suspect. Education, for example, play a very key role. Gender is also there. Household size is also there. Whether you receive remittance from abroad is also there. And yeah, the very usual suspect. Yes.
Thanks. So I was wondering if you looked at trajectories as well. So do you find cases, for example, of households that are in poverty for you have 3 rounds of data, right?
Yes.
So in poverty for the first 2 rounds, and then they
Exactly.
like, do you see like these sort of trajectories where there's like almost a structural break and people manage to escape poverty, or is it relatively monotonous? Basically, if you are in this chronic poverty state, you're essentially staying.
No, thank you, Philip. Yes, I think that's a very important question. So specifically, I did not do this. What I did not so close was just to look at exit and entry. So I looked at exit, entry, and then persistence. So how I define persistence: if throughout the wave you never came out of poverty, sort like that, but not as granular as you say. I guess it's just I just did the standard exit, entry, exit, and then persistence, and then look at the correlates of that dynamics, but not sort of really check and see, oh, did you exit in the second round, which I think would be an additional thing to look at. But that is well noted. Thanks.
Thank you for the presentation and the paper. I was wondering if you did any analysis at all on households that potentially exited poverty but then re-entered it. And if you did any analysis, how do these households differ from those that have exited poverty and stayed out of poverty?
No, thank you very much. I think this is sort of close to what Philip asked. No, I didn't do that specifically, but my sense it will be an interesting thing to look at. So I could definitely, it's possible to look at those that exited and came back and see sort of what are the factors that brought them back, how they are different from those who managed to stay out, right? No, but thanks. That's well noted.
Excuse me, sorry. I think this question is going to reveal I don't completely understand the econometrics that you've done on the controlling for the random effects for the household level effects. And the question I have is, if I think of the random effects as opposed to a fixed effects estimator here, I think the reason why you're not using a fixed effects is that you're going to be sweeping away essentially all the information about the persistent households. But then it sounds to me like this random effects controlling for some of the household attributes, conditional on the household attributes, is moving closer to a fixed effects estimator in the sense that it's sweeping away some of your estimation power on the factors that are distinguishing between persistent and transitory households. And so given that your findings are kind of resting on the lack of statistical significance in that second column effect, and that's where you're drawing your inferences from, I'm struggling to think of, is that a finding or is that an indication of a decline in power? And I think to help us, for me at least, to help think about that issue of what's going on with this estimator, how much of it is coming from a loss of power and how much of it is coming from something that you think is true signal coming out would be super interesting to hear a reaction to, or to help me think about it. Thanks.
Okay. So no, thank you, definitely. So no, I see your point. So I think it's something that I definitely need to look more closely. So my sense currently is that is okay. I don't see it more as loss of power. I see it as no effect. But I see the point you make that it's possible that this could also be as a result of loss of power. But the way the random effect that I estimated is sort of set up is uh lean towards me seeing it from the angle that this is loss of effect and not loss of power, right? But of course, I'm happy to look into this more, and also happy to discuss after now. Thank you.
So I will go in the same sense that Sir that just uh, talk. You really exclude the causal persistence based on your second estimation, and I was also trying to see if you cannot nuance your conclusion, because actually, even if you lose the effect, the standard error of your coefficient was really high. So I was really thinking about maybe have cautious interpretation about just eliminating the true persistent the true state dependencies. Like maybe try to look what maybe the causes, maybe also you just have 3 waves of panel data, so that's might also be a reason. So second element that I saw was about the gendered results. I think in the paper you didn't put the number of observation, and I was a bit not confused, but I was taking the female result a bit with cautious, because lots of your coefficients were not actually significant. So I was maybe wondering it's not an identification problem in your model. So maybe take the result that you have for the female with caution. And another element, it's about the data measurement, because you built your poverty line yourself on the data, and you took, I think, the strategy of the CBN, like the cost of basic needs, and you use a threshold of, I think, 3,000 kilocalorie, but it's not that usual in the global literature. So maybe, I don't know, play with that threshold and see if maybe the result change based on the results, just as it's just a comment that maybe you can do that to see if maybe your results are robust to the poverty lines, because it can really play a key role. So you're like, just thank you. It was a really interesting paper.
Thank you, definitely. I will not attempt to respond to your comments. I know we don't have time, but just on the last one for the 3,000, I think each country, I'm trying to remember whether it's the World Food Program, they have like a number for each country. So as at that time, I took the one for Nigeria. But we might have changed now. But thanks, yeah.
Hello, everyone. I'm here to present this work together with Benoît Desser. It was a World Bank policy research paper, and it was about reconceptualizing global multidimensional poverty measurement with illustration on Nigeria data. Okay, first, let's start with the motivation why multidimensional poverty matters. First, in the early stage of well-being measurements, GDP was among the main, GDP per capita was among the main indicators used to monitor global development and growth. But the first problem with this kind of indicator is that it's ignore who actually benefits from development. So monetary poverty indicator then emerged, and they track who were the people below a certain poverty line. But those monetary poverty indicators also has another concern. It's the dimensional concerns, in the sense that monetary indicator may miss some key other dimension of well-being, for example, health, housing, or security. So MPM, multidimensional poverty measurement, can be really a unique tool to try to address both concern, the distributional one and the dimensional one. So MPM already exists. Some of the key ones. First, the one from the World Bank MPM. For example, that one, it includes the monetary dimension. It also tracks non-monetary indicators, but it's ignore mortality and health outcome and only include health inputs. We also have one of the largely used one by the country to compare level of development across countries. So first, it didn't include monetary dimension, but it really have a broad non-monetary coverage of non-monetary dimension. It ignore mortality partially, in the sense that it's kind of includes child mortality in the health dimension. So these are those the two main, I will say, globally used MPM, and those two are based on I will say, poor identifications methodology developed by Alkiri and Foster. And the idea of this methodology is quite simple. Is first, for each dimension, set up a deprivation status to state who is deprived or not on that dimension, and then weight the deprivation that you have across all the dimension and compare those deprivation to a certain identification threshold. So it's really a popular methodology, clear identification methods, but we really think that it can be improved, in the sense that it can be improved to include a preference-based identification of poor. And that's what I'm going to present. So here we are putting two main criticisms to the existing MPMs. First, that those MPM doesn't align with the preference theory, in the sense that the weight and the deprivation cutoff, as well as the identification threshold, are chosen without being grounded in a preference-based theory with the utility, saying that people may actually make a trade-off between the dimension of well-being. Second, it's that those multidimensional poverty measure, they don't, or just partially include mortality. And we think that mortality is really a key dimension that we should take into account, in the sense that being deprived of life is itself a dimension of well-being. And the idea of this work is to work on those two criticisms, bring refinement based on those criticisms to build a new multidimensional poverty measure. So in this paper, we will be answering basically two questions. Do the refinement that we bring based on the two criticisms bring change in well-being comparisons? And how biased are the well-being comparison based on monetary poverty alone? So let's start with a bit of conceptual framework, like a person who is actually poor that just means that her utility falls below a threshold. And you can see there the indifference curves in blue. And on those maps, you can see that that indifference curve has really two key properties. The first one is the positive asymptote, meaning that actually someone with a really low, I will say, look at the individual X, you can see that he has a really a low well-being in the dimension 1. And despite having a pretty high well-being in X2, he's below the indifference curve. And that is the first property that we want to keep. And the second one is that the individual is always capable of trade-off between one dimension and another and stay on the same indifference curve. So the idea here is to show that actually, if we want to follow the preference-based definition of poor and the utility indifference curve, you can notice there are two types of poor. Like the one that we will call the extremore, meaning that they are really highly deprived in one of the well-being dimension, independently on the other dimension, and what we will call the cumulators, and those are those who are accumulating small deprivation but on several dimensions, poor. Yeah. So based on this definition of poor, the idea here is to show you the constraint of the existing methodology, the Alkeri-Forster methodology. If, for example, we take the first graphic, you can see that when we have like just one, a threshold, like quite low threshold, the red line, the identification line, will have a lot of, will be really bad at identifying the cumulators, but good at identifying the extremors. But when you put like the threshold for each dimension a bit bigger, you will have like this red line on the second map, the red line identification curve, and you can see that on that side, the extremor are like badly identified, where cumulator might be better identified. So the idea is to take the best of the two worlds. Instead of just using one threshold, why we shouldn't use two thresholds, an extreme one and a moderate one, such that we can have an identification strategy that can be closer to the preference-based definition of poor. So that's the first refinement that we are bringing through this paper, and we call that the refined Alkeri-Forster approach. So basically, we will have to identify two types of poor: the extremors below a extreme threshold in only one dimension, actually, because being extreme in one dimension will be a sufficient condition to label you as poor. And the second one will be the cumulators, and those will be those who will accumulate moderate deprivation across two dimensions in this framework. Yeah. So in each dimension of well-being, we will have like three deprivation status: the extremely deprived, the moderately deprived, and not deprived. So second refinement is the integration of mortality into our measurement. But that's a bit sensitive in the sense that it's really tricky to put together a multi-dimensional poverty measure with mortality. So the idea was based on a previous paper, Balland 2020, 2022. And the idea actually was to combine the life a person may have losing her life and the years that person will spend in poverty. So you will have like the mortality deprivation coming from the life, the years that you lose prematurely, and the years that you spend in poverty. So based on that theory, we propose this indicator that we call the poverty adjusted life expectancy. So based on the life expectancy of the country or the region, depending on the level where we are, we complemented that life expectancy with the multidimensional poverty that we just computed using our two-level threshold. So the idea is quite simple. The mortality will be included based on what we call the weight on mortality here, theta. And in this framework, we use two value of theta. The bigger theta, the less weight we put to mortality. Like with theta equal 1, we actually make the assumption that being dead equal being poor. Like that's really the lowest the lowest bound that we can give to mortality, and the lower the theta and the bigger the weight that we give to mortality. For example, if we have theta equals 0.5, like that means that we actually suppose that 1 year of life lost equal 2 years in poverty. So based on those different design, we compute this second refinement. So let's move on to the results. First, the data context. Okay. The data context, it was in Nigeria, and we use mainly the Living Standard Measure survey from 2019. And we argue that it's really a conservative context in the sense that first, Nigeria in 2019 had already a high monetary level of poverty, and the heterogeneity across states was really, really high. We have like figures ranging from 10 to 19%. And we also have data on life expectancy at birth at 49 years. So just the big pictures on Nigeria data. So here we choose 5 dimensions of well-being. So the monetary, security, health, education, housing, the one usually used in pre-existing multidimensional poverty. And for each, we define an extreme and on moderate threshold. Just notice here that throughout the work, we use on a baseline scenario with really conservative assumption, and then what we call a preferred scenario with less conservative assumption. So here I will present mostly the result on the baseline one. And what you need to know is that for the baseline one, we consider as monetary deprivation, the extreme monetary deprivation being below the national poverty line. And we made the assumption that no one were actually moderately deprived. So the moderate deprivation was just added for the preferred version. And same for the education dimension, we didn't add it to the baseline scenario. So just to give you a big picture of the deprivation across dimension. So for the baseline scenario, you can see that monetary is still like the dimension bringing the more well-being loss across all the dimension. After that, I think we have housing, and you have the decomposition of those deprivation across extreme for the orange and yellow, moderate for yellow. So based on our refinement of the multidimensional poverty measure, we found out that actually, yeah, that's better. Actually, we found 51.9% of Nigerian population were poor, multidimensional poor, based on our definition, compared to around 40% of monetary poor. So the idea that we had here was to overlap the monetary poverty with our multidimensional poverty to see who are actually those who are missed by the monetary dimension and who are those who are consistently poor. And you can also see here that we have around 11% people who were actually missed. And then we omitted. So we then split those omitted poor between the extremos and the cumulators and try to identify the dimension that were actually much more contributing to making them poor. And a quick say here, here the idea of this result was to see actually what's the impact of taking into account the depth of the deprivation across each dimension, taking into account two cutoff. So we make a counterfactual analysis with just one cutoff, just using the moderate one, and see what was actually the impact. And we see that ignoring the depth of the deprivation reduce substantially the identification of the other dimension poor. So here also we try to measure the impact of adding the mortality dimension. And maybe you can ask me a question maybe a bit later about it. But we found that more than 30% of the well-being loss was actually attributed to the premature mortality in the baseline scenario, the conservative one that was putting like less weight to mortality. So just to give you, it's done? Okay, an overview of the works. So in terms of policy implication, the key finding was that first, the depth of deprivation is critical and matter, and mortality also matter, and those results were shown through also some policy, I will say policy simulation that we made, and that was made through a ranking and budget allocation, and those refinements show that it's really matter to take into account those two refinements. Thank you.
Okay, thank you. Very, very interesting paper. I'm not familiar. I'm not very familiar with the literature on multidimensional poverty measurement, so I was quite interested to read this paper, and I learned a lot. It was very well written. Both the theoretical and the empirical part are very insightful and easy to read, even without any knowledge of the main question. Even the complex stuff is very well explained. So congratulations for this paper, but so also apologies because the comments might be very general and based like more at addressing general problems with the multidimensional poverty literature than specifically maybe about your paper. But my main question is whether you are trying to measure well-being or poverty. And in the paper, you switch consistently between well-being and poverty, and we don't really know what you are trying to measure in the end. And I think these things are quite different because, like, if you look at any definition of well-being and poverty, these are quite different. Well-being includes being healthy, being happy, being prosperous, etc. While poverty, it's a bit different. It's really related to material possessions, at least when you look at definition. And I understand that you want to bring a bit the two together, but then it's a bit confusing what you're actually measuring. And typically, if, like, for some of the dimension that you are considering, the tension is a bit greater. For example, for security, it's clearly a source of well-being, but is it poverty? It's not completely clear. You can live with a lot of money and a lot of wealth in a very insecure environment. Think about South Africa or other countries where security is a big issue, but you can have a lot of money, and people would not say that these people that live in rich neighborhoods are poor. Similarly, for mortality, it can be a source of well-being loss, but many causes of mortality, especially for non-communicable diseases, are not related to poverty. So then I think in some of in the methodological innovation of your paper, but I think a lot comes from actually the paper of Benoit de Serre in 2023. So it may be not really about your paper itself. You are criticizing the method of Alcaire and Foster because there are many choices that are arbitrary and that needs to be made. But I have the impression that you don't really reduce the number of arbitrary choices that are needed actually in your paper, because you need to select 2 cutoffs per dimension. You need also to select how you will characterize these, not the extremors, the other one, the one that are combined, like have multiple dimensions that are the cumulators. You need to define a rule to define the cumulators, etc. You need a value for theta and for different parameters. So I'm not sure you're actually addressing that. In the empirical application, which is I find very interesting, and it's actually the main contribution of your paper, so it's great that it's also perhaps like the most interesting part. I see that you are comparing your measure with, in a way, the worst poverty measure that is existing, which is the poverty headcount. And why it's the worst? Because it's not distribution sensitive. And there are many distribution sensitive poverty measures. And so that means that you're comparing, like, not really checking whether the dimensional nature of multidimensional poverty matters, but you are comparing a measure that is non-distribution sensitive and non-multidimensional to something that is distributional and multidimensional to some extent. And so the question is, are the differences that you find linked to the distributionality or the dimensionality of the measure you propose? And that's not something that we can say. So maybe you should instead focus on distribution sensitive measure. Yes, just a suggestion. It was very interesting, the application, and actually I found that like monetary poverty is not that bad, because actually it identifies quite many pores, and it has a huge overlap with the multidimensionally pore. But maybe that's because you picked Nigeria, and so the question is how that would look like in another setting where lower degrees of poverty, and you specifically say that you select Nigeria to be conservative, but then it begs a question of, okay, what would happen in other contexts, and maybe actually your findings would be even more salient. I guess you know that, but that's something that might be interesting to do. I know it would be a lot of work, so maybe it's not possible, of course. Yes, I'll send the slide. I had another question about extremors. So the extremors are typically poor in one dimension. I'm wondering whether for these extremors, it's often something else that may be at play than poverty. So imagine you have a lot of money, you have a lot of things, but then your extremors in health, for example. Typically, it's not because you are poor, it's typically actually because you are unlucky and you have serious health issues. And so I'm wondering whether there is a bit more investigation that needs to be done for these extremors in one dimension, because often I think it will be not linked with what anyone or most people would understand by poverty. Thanks a lot. Are there any other questions? I think we have 2-3 minutes for questions.
So I think this introduction of the adjusting for life expectancy is really a nice adjustment. I've liked that in many papers. If I'm following it right, though, it's not really distinct. It's the same for everyone within Nigeria, I think, if I'm following it correctly. And so it's when you do the cross-country comparisons that you're getting some traction on that. No. So you're doing state level variation in it. Okay, that's that I wasn't quite following. So that's quite nice. I mean, I think for people to learn a little bit more about the level of variation that we have in this, and the comment that I have on that is, it might also be useful to recognize that within countries we don't have that much typically variation in life expectancy, but over time we do. And so you could think about, within a household, everyone has the same monetary poverty status and the same poverty status and all the other attributes, but everyone has a different life expectancy because they're different ages. And kind of leveraging that bit of information might be really pretty fascinating to suggest that maybe kids are better off than parents within a given household. That's certainly an implication of this. And leveraging that might be really a neat kind of angle to take on some of this stuff. Thanks.
I have more of a comment than a question, I suppose. So when you started off saying that these measures, such as the MPI, they don't capture the preferences, poverty preferences or views of the people specifically, I think I expected a bit something else. And I think what you're actually measuring is a more distributional, sensitive, or nuanced, fine-grained view of poverty, because actually the MPI also exists in national forms rather than the global MPI, and the national ones are actually determined by the country themselves. So the thresholds and the weightings are not necessarily the same across countries, right? So they actually, to some extent, capture the poverty preferences of the country, and in many cases, they're also determined in consultation with the population. So I think that the preference part, and as your colleague pointed out, there are loads of points in your measurements where someone or you externally determine those. So just wanted to point that out, if that's helpful.
I think we'll have to switch to the next one, but maybe if you have a short response.
Yeah, short response. I think maybe there is a misunderstanding about what we actually mean by preference here. It's like really preference at the individual levels, like how people made trade-offs between dimensions, like based on my current like constraint, can I have more health or less security? Like made those trade-offs. So ground the identification of poor based on the preference theory, like the utility theory. So the preference here is not the preference in terms of preference in choosing the threshold that are, I will say, country specific, but it's really trade-offs that people made really at the individual level. So I don't know if I answered the question like.
Okay, let's turn to the next presentation. Thanks a lot. Maybe. So my presentation is about inequality, and I think everyone will agree in this room that inequality matters. And so the specific question that we are trying to address with Domenico Moramarco is, who is driving inequality? Where is inequality coming from? If you think about global inequality, which countries or regions are driving inequality globally? If you look at the US, which states or which other groups, it can be ethnic group, it can be gender, it can be based on any splitting of the entire population, which groups are driving inequality? And there are two ways, in a way, of thinking about this question. The first type of question that can be addressed is by assigning a specific contribution to each of the subgroup in the population. So for example, to each country globally, you'd say, okay, this is the contribution of the US, this is the contribution of Nigeria, etc. Okay, and so that allows answering a question like, which countries contribute most to global inequality? Is it India and China with large population, or is it high inequality countries like the US, Brazil, South Africa, etc.? And then there is another way of thinking about this question, which is to look at difference between group inequality and within group inequality. So is global inequality, for example, driven by differences in the average income between countries, or is it differences within each of the country that matter? Okay, I'm thinking here about differences between countries, but as I said, you can think about any dimension. And the literature so far has mainly focused on this type 2 question. So splitting, and typically what has been done in the literature, additively, inequality in between and within group components. Okay, so the main form that has been studied is this additive decomposition in one term, which is the between group component, one term, which is the within group component, and basically the between group component looks like, consider only the average income in each of the group that is considered and looked at how unequally distributed is average income in each of the group. And then you add that, to that you add a within group component, which is basically a weighted sum of inequality in each of the groups, so in each of the country. And different people, including Sherrock, have studied this decomposition approach, and they found that only the generalized entropy class of measure is compatible with this form of decomposition. And Sherrock even generalized that to any form of decomposition, and finding that that leads to only monotonic transformation of the generalized entropy class. And so in a way, the literature was almost closed, because any decomposition leads to that class or transformation of that class. So in a way, you lose nothing if you just focus on that class of function. But that's not completely satisfactory, because first, it focuses only on one type of decomposition, so the type 2 questions. Second, the decomposition weights actually in this decomposition, they do not sum to 1, and that leads to different conceptual issues. For example, all the groups might have the same within group component, the same inequality, yet the total within group component might be different at that level of inequality, etc. But perhaps more importantly, this generalized entropy class is difficult to interpret with something. It's an arbitrary formula, which is very difficult to understand from an intuitive sense. And so in practice, what does it mean? It means that people, they typically use the Gini or similar measures that are very intuitive to describe inequality. And then when they want to decompose inequality, they actually use the generalized entropy just for that specific exercise, and then they go back to using a more intuitive measure. And so there is somehow this dual approach, which is a bit confusing. And so there is a question of whether we can find a class of measure that addresses all these problems. So that focuses on type 1 and type 2 questions, that has weight that sum to 1, and that leads to a measure that is intuitive. And that's what we try to do in our paper. We studied 2 new forms of decomposition. First, an additive decomposition, which is quite similar to the one we just examined, but it doesn't have the between group component. So the idea is really to assign a contribution to each of the subgroup. And then the second form of decomposition that we study is a multiplicative decomposition. So it's very similar to the one studied by Sherrock, except that instead of a plus, you have a times there, you have a multiplication between group and within group inequality. And I think it's easier to understand if you look at the figure, because basically that's total inequality. And what Sherrock is doing, is proposing, is to split total inequality in a between group inequality component and a within group inequality component, which is itself the sum of the contribution of each of the subgroup. What we try to do in our 2 decomposition is to assign a specific contribution to each of the group without looking at between group inequality. That's the first exercise we do. And the second exercise we do is to look at within group inequality and between group inequality more in an interactive form, in an interaction form, to look at the complementarity between the 2 approaches. So total inequality is the product of the two terms. And so if you double between group inequality, you will double inequality. If you double the within group inequality component, you will also multiply inequality by 2. And so a few theoretical results that we obtain in our paper. So first, an inequality measure satisfies multiplicative decomposability if and only if it also satisfies additive decomposability. So that means that these 2 forms of inequality decomposition that we are studying, actually closely associated, they imply each other. Another result that we find is that actually these forms of decomposability are incompatible with normalization in 0. Normalization in 0 means that perfect equality is attributed the inequality value of 0. And that's just impossible with actually multiplicative decomposability, because the neutral element in multiplicative decomposability is 1. And so if you look at the formula, it makes clear that you cannot put normalization equal to 0, otherwise everything vanishes, even if you have, for example, within group inequality, but no between group inequality. And so what we do is to use another normalization than typically assumed in the literature and in Sherrock, etc. We normalize to 1, and that's why we manage to obtain different results than what they do. The second theorem of the paper characterizes the class of inequality measure that are compatible with these decompositions, these two different decomposition formulas. It's a very simple average, the new class of inequality measure, a simple average of ratios. And so basically each of the ratio tells you how far individual incomes are from the mean, and there is an exponent that basically is shaping this functional form, and it's basically inequality aversion. With the higher the epsilon, the more inequality averse the inequality measure will be. And so let's look at the two decomposition formulas and their weights. So the additive decomposition in subgroups takes this form with these weights, and the weights in the two decomposition formulas are relatively similar. So let's discuss these ones, for example. So if epsilon is higher than 1, which is, I think, typically the sensible thing to do because it gives greater weights to the poorest, then you'll have that the weights will increase in population size, which makes sense, like a larger population will be given more weights, and also the weights will be greater for poorest populations, so it gives more weights to the populations or the groups that are lower, that have lower levels of incomes on average. And this is the form of the multiplicative decomposition with the weight, which are actually the same as the one before, but expressed as a share. And what is a nice thing is that they sum up to 1 for any values of epsilon, which is not the case with the generalized entropy measure. And there is one specific functional form that is very interesting within this class of this new class of inequality measure. It's this one, which has actually been identified in a previous paper, including with Dean, who is there. It's the measure that corresponds to an inequality aversion parameter equal to 2. The functional form becomes very simple, and this inequality measures has different advantages. First, inequality aversion equal to 2 aligns well with the values that have been found in the literature or that are used in the literature for for inequality aversion. Second, it leads to actually an intuitive interpretation of the measure. So as the one interpretation is as the expected ratio of incomes between two randomly selected individuals in the population. So you take two individuals randomly in the population, the expected ratio of the income is the measure. So for example, in the US, the measure, the most recent value is 4.9. So you take two individuals randomly in the US, you'll get on average a ratio of 4.9, while in China, for example, it will be only 1.5, showing that China has much more equality than in the US, and in the US, inequality is very high. And then a third advantage, it says it has a very interesting connection between poverty, average income, and this new measure of inequality. And maybe to introduce that, I'll just refer to a slide from another paper that I have on how to measure poverty without poverty line. And this shows you how the poverty rate and the poverty headcount have evolved over time, considering different poverty lines. And it shows basically that depending on the lines that you pick, you can reach any solution, any conclusion that you want. Either poverty massively decreased, which is a success for anti-poverty programs, or poverty is super high if you consider high line, suggesting that anti-poverty programs have not worked. And so basically that's the problem of current measure with poverty lines, is that they heavily depend, of course, on the poverty line you picked. And so in other papers, including with Dean, and we have proposed another measure, which I use to measure poverty, but in our paper, we use it to measure welfare more generally. We propose not to use actually a poverty line, but rather to use a continuous measure of poverty or welfare. In one of the papers, so we define poverty as the reciprocal of income, and so units are simply inverted. Poverty then becomes the average number of days that you need to get $1. For example, in Congo, you need on average 1 day to get $1. In China, you need 2 hours. In the US, 85 minutes. In Switzerland, 25 minutes. So that's a very nice measure that has actually been adopted by the World Bank as their measure of shared prosperity. And what is nice is that you have a link between this measure, the measure of inequality that I just discussed, and average income. Basically, poverty is the ratio of inequality and average income, meaning that any change in poverty can be either attributed to changes in inequality, the dispersion becoming more or less widespread, or changes in average income, so income growth or degrowth. And so that's very interesting in terms of policy implication, of course. I'll show an example now focusing on global inequality. So these figures show how global inequality has been decreasing from 5 in the 1990s to about 3.67 nowadays. That means that if you pick two individuals randomly in the world, the ratio of their incomes on average will be 3.6. It has been decreasing. Why has it been decreasing? Primarily because between country inequality has been reducing over time. If you look at inequality within country, it has stagnated. If anything, actually, it has been increasing over time. This is another way of showing exactly the same data, basically, but more showing or making more salient the interaction between the two dimensions, between country inequality and within country inequality. And you see that it's mostly between country inequality that is the driving factor of reduction in total inequality. We can split and calculate the total contribution of each country to find which country actually contributes most to inequality. And what we find is that it's India and China with their large population, although moderate inequality, but very large population that contributes most to global inequality. But there in the ranking, you also see very poor countries that also have relatively large population, like DR Congo or Madagascar, and also relatively at the top of the list, countries like Brazil and the United States, which are there because they have super high inequality level within their countries. So, as I said, there is an interesting link with average income and poverty. So this is how poverty has been, like average poverty. So the average time it takes to get $1 has decreased over time. So it has decreased globally from about 10 hours to get $1, 10, 11 hours to get $1 in 1990 to about 5 hours to get $1 nowadays. So huge reduction in poverty. And that can be decomposed to understand why did poverty decrease so much over time? Is it due to reduction in inequality, or is it due to average income growth? And so we can do that for use this decomposition formula that I just explained to understand for different countries where how the countries have been performing. And so, for example, in the United States, for the same period, we see that there was income growth, but actually inequality increased much more, implying that poverty increased on average because inequality growth was larger than income growth. In Belgium, you have something different. You have that both average income increased and inequality improved. So you have a sharp reduction in poverty. In Zimbabwe, you have that inequality increased and average income reduced on average, and so you have a huge increase in poverty, etc. And we can do that for all the countries and actually study whether poverty reductions on average are driven by income growth or whether they are driven by changes in inequality. And when you look at that for all the countries in the World Bank data, what we see is that we see a clear correlation between changes in poverty and income growth. And so it's mostly income growth that has been the driving force of changes in poverty over the past decades, while when you look at inequality, the situation is more fuzzy. The inequality has the changes in inequality are much less salient in the data, and sometimes positive and negative, and so it's not inequality changes that have been mostly driving in poverty reduction over the past years. If I have a bit of time, I'll just show also some numbers for US inequality, and it's interesting because the results are very different. So here in the US, inequality first is quite high, but it's mostly inequality within states that has been driving changes in inequality in the US. Actually, inequality between US states is extremely low. Okay, so the average incomes in different US states are relatively similar, but what matters is the distribution of incomes within US states. And this distribution has become more unequal over time. So here we look at 1998 to 2019, if I'm not mistaken. And we see that in all the states considered in all the states in the US, actually, inequality has been increasing, and I've just showed how it has been increasing over time for the most populous states in this figure. And we can, of course, also rank the different states in the US and characterize which state is driving inequality in the US, and we find that it's mainly the most populous states that are driving inequality. Why? Because actually inequality is very high everywhere, and so the measure gives more weight to the most populous states than in this case. Conclusion, we propose a new class of inequality measures, which we derived based on two new forms of decomposability, one multiplicative form in between and within group inequality, and one additive form in subgroups. And for epsilon equal to 2, we have a very nice inequality measure that was identified in some of the work that I've done with colleagues at the World Bank. And the World Bank endorsed the prosperity gap, or the average poverty measure that is associated with this inequality measure, which has very nice interpretation. And so I think that could be used in empirical work. Thanks a lot.
Olivier, that was a really interesting piece of work. I always enjoy the work that's based on PIP by this group of people. So I really like the this interpretation with the inequality aversion at 2, where you basically randomly draw 2 individuals from the population distribution, and then the inequality is equal to their ratio in incomes. So I think the biggest strength that I see in this for applied research, for empirical research, is its interpretability. But because of that, because I think that is their biggest strength, my first comment is about this fact that the decomposition weights are high for the countries or the states in the US case that are large and poor, right? Regardless of how unequal they are. So basically, I think what that is saying is that, you know, China and India drive global inequality, but they're both not super unequal internally, right? And so, in a way, I see how that comes about, but it maybe takes away a little bit from the more intuitive interpretation of this. So maybe you can kind of contextualize this a little bit more and explain this a little bit more. Then I have 2 more points that are in the paper. You didn't mention them here, but so one is on the bottom coding. So for the empirical exercise, right, you use the $0.25 or 25 cents a day, which is sort of what is often used, and it's something that I've used in my own work. But I wonder if in this case, because countries like DRC and I think Ethiopia was the other one that are relatively high up, yeah, where I don't know if it's very sensitive to this bottom coding, basically the question who drives inequality. So I don't obviously have a better idea of how to do this, but I wondered if you did 50 cents or if you did 20 cents, would it change dramatically? And then similarly on the US data, so I was wondering if this tax form, this IRS tax form data, does that include, like, are there people in the US that don't file tax forms because they're very poor? So again, this would be the bottom of the distribution that might be a little bit misrepresented or underrepresented, put it this way, if they don't file. And I wondered if that then, again, could bias these results a little bit. I don't think it's critical because I think what you're trying to show, you're showing, but that's something I was thinking about. Those are my comments. Short. Do you want to come back up here to address, or?
Thanks a lot. Let me go here. Okay. It's working, yes. Yeah, thanks a lot. Thanks a lot for the comments. On the decomposition weights that give a lot of weights to population, in a way you can use a different value of epsilon and that will be different. But still, I think that using epsilon equal to 2 makes sense. And I'm wondering whether it's a problem or whether it's a good thing, actually, that countries or states or regions with a large population are given more weights. To some extent, it might actually unbias our perception that to consider each country equally in a decomposition framework, for example. And actually giving more weights to the largest population, in a way, that's what you want to do also from a policy point of view. Something that I didn't mention, actually, is that the functional form of the weight, especially of the first additive decomposition, is the same as the weights in the generalized entropy measure. And so in a way, that problem would apply to both classes of measure. On bottom coding, I mean, it's a fair question whether the result would change with 0.25 or another threshold value. At least for the papers that we did on the prosperity gap and on average poverty, we tested different thresholds and we didn't find different results. We didn't repeat the exercise for inequality, but I guess we would get similar values. I don't know if you're involved in this paper on bottom coding. You may be, so you would be better at answering this question, but I know that these people at the World Bank have spent a lot of time thinking about all the possible ways to take into account low values in the distribution, and they found out that that was maybe the most transparent and easy to implement solution, and that was working quite well and robustly. So there is a paper, I think, that you have released on that, and I don't know it very well. And then on the tax form data, I'm sure that some people are excluded. I will not tell you exactly who is excluded because I might make errors there, so I'll just revise and redo my homework and indeed mention that in the text who is excluded from the data. It's an important question. Our objective is to illustrate the method, so even if some people are excluded, it's not in a way a big deal for our paper, but still I think it's important to note that in the presentation and in the paper, so we'll look at that. Thank you.
Thank you so much. I really enjoyed that. I don't want to be over the top, but it's one of the most interesting papers on inequality measurement in the last 40 years, I'd say. So I shall look forward. Sorry, maybe I've gone over the top, but you know, I love that Shomuk's paper. And, anyway, I haven't read it yet, so I've just seen your presentation, but it's really interesting and I look forward to reading it. My question, and I clearly need to think this through a bit more, I'm kind of intrigued by the fact that you've gone in the direction of the multiplicative decomposition, but it kind of, and this in a way makes a lot of sense, kind of intrigues me that you're combining the multiplicative way of capturing the between within versus the additive within the within, if that kind of makes sense. And I don't know if you've got a way of kind of intuitively explaining that, because it's entirely possible that that actually makes an awful lot more sense than the additive and additive. But yeah, I don't have my head around it yet. I'll read your paper, but I'm just intrigued about whether you've got a kind of a quick intuition about what's going on there.
I mean, I completely agree that there is something counterintuitive why this additive form is implying and vice versa this multiplicative form, and we don't have a very good explanation for that actually, unfortunately. And why did we focus on multiplicative decomposition? Actually, it's a bit random. It was when doing this research with Dean on the shared prosperity indicator, we discovered that there was, of course, an inequality measure associated with this shared prosperity measure. And then, as in the literature, we tried to decompose it, and we were struggling to decompose it, to etc. And then randomly, when playing on Excel, we discovered, but actually, multiplicatively, there is something going on. And then that led the way to this paper. So I'm presenting this paper as if we started from the formula, but actually we started from an Excel sheet and trying to find the relationship between the variables. Thanks a lot.
Welcome everyone to the last presentation of today. I'm Philip Wollburg. I'm with the World Bank's LSMS team, and I'll present this work on high-frequency food insecurity measurement. This is a joint work with Dean Joliffe, who's here, and Yannick Markov, who's also there. And so, so this is work based on the LSMS high-frequency phone survey data that my team has collected, and it's a cross-country study. I'll get to the data in a second. But so the background is, food insecurity remains a pretty big problem, where, according to the latest FAO State of Food Insecurity report, 2.3 billion people worldwide were food insecure, and 2/3 of the population of Sub-Saharan Africa is experiencing this, what FAO describes as moderate food insecurity. SDG 2 and specifically the SDG indicator 2.1.2, they're calling to end hunger and ensure food security for everyone all year round. And so there, talking about measurement already, there is a sort of, at this high level, there is an acknowledgement that food insecurity, in a way like poverty, is a dynamic phenomenon. But the measurement and policy practice is not really recognizing this, or in a way, if we look at how SDG 2.2.1.2 is measured, or the IPC assessments, right, which are probably more consequential for interventions and for policies, these tend to be single point in time FIAS measures that, much like with the poverty presentation at the beginning of this session, are not well placed to capture dynamics in food insecurity. And so the problem is that food insecurity, if it's a dynamic phenomenon, if we believe that, it's going to matter whether the experience is chronic or whether it's transient for the kinds of policy interventions that we would propose, and I think also intuitively whether a household occasionally experiences food insecurity, or whether they're food insecure all the time, is clearly a different state of affairs. So we are using this chronic versus transient food insecurity framework for this paper, where we're borrowing this distinction from the poverty dynamics literature, where this is well established for a long time. The idea is that chronic food insecurity is a structural deprivation that is persistent across time, much like chronic poverty, and it calls for these longer run investments in assets, human capital, and market access, while transient food insecurity is more of a shock driven and episodic phenomenon, and there maybe it's enough to provide income assistance, but it's important to do it in a sort of shock responsive and timely manner. And so what we're doing then in this paper descriptively is testing the chronic versus transient food insecurity dimension at scale using this large longitudinal high frequency food security data set. And I'll try to draw out some lessons for both measurement and targeting and policy. Okay, so this is the data set that we use. So we have the LSMS high frequency phone survey across 6 countries in Sub-Saharan Africa: Burkina Faso, Ethiopia, Malawi, Nigeria, Tanzania, and Uganda. This builds on the LSMS ISA surveys that many of you are familiar with, and that we've seen used. The Nigeria one we've seen used also already in this session. And so basically, starting in 2020, the team ran at sort of a relatively high frequency, these longitudinal phone surveys. We have 115,000 interviews from more than 17,000 unique households. And so here, let me see, you can see this. So this is the temporal distribution of these interviews. You can see there were sort of 2 phases in 2021 and then 22 to 24. And this is the extent of our data. We're relying on a pretty common food insecurity measure. The Food Insecurity Experience Scale, or FIAS, is the FAO standard. This is an 8-item module where we're using a 30-day recall version and basically answering affirmatively to more of these items means a higher food insecurity severity. And so the FIAS raw score is just a count of how many items were answered affirmatively. And so a higher FIAS raw score means a worse food insecurity at that moment in time. We're working for the main results with this cutoff at the raw score of greater or equal 4, which is the cutoff that tends to be used for moderate food insecurity. So in a way, there's also a few different ways of deriving this moderate food insecurity number, but this is a standard way of doing it. But the results also don't really depend on which cutoff you use to do this. And so based on this FIAS score and this cutoff for moderate food insecurity, we classify households in each calendar year as either never food insecure, right? It's clear those that never had a FIAS raw score above 4. Transiently food insecure are households that we observe within the same calendar year to be both not food secure and food insecure at different points in time. And then the chronically food insecure are those that always have a FIAS raw score above 4. And so in the first set of results, I'll just show you kind of the distribution of these 3 groups. So first, this here is a histogram, right? And we have the percent of rounds, or the share of rounds, to be precise here, that households experienced food insecurity, and this is the percent of households. And so at 0, we have the group that I just called the never food insecure households. That's 34% of our sample. And between 0 and 1, here are the transiently food insecure households. This is, you will notice, the largest single group among the food insecure, and also just the largest single group in the population. And then at 1 are the chronically food insecure households, those that are food insecure in each round. And so, of course, I already kind of said this at the beginning, but by construction, cross-sectional measures are going to miss these transiently food insecure, or going to miss the distinction, and are always going to miss a part of the transiently food insecure households, because they may appear to be food secure in a certain round, even though maybe a few weeks later they will be food insecure. And so what this means is that, you know, these standard measures of food insecurity prevalence will underestimate or undercount food insecurity. And so in this very busy graph, we are trying to essentially show by country and by year how much this undercount would correspond to, right? So let's go through the graph. So here, these diamonds, this is the share of the population that is experiencing food security at least one point in a given calendar year. In this case, this is Malawi in 2021, right? So about 80% of households experienced food insecurity at least one round in Malawi in 2021. So you will notice this is the sum of the chronically and the transiently food insecure households. Then we have also for each country and each year an annual average, that is the average taken of all of the different rounds. And you can see that this annual average is much lower, and it's much lower across the board than this ever food insecure, this longitudinal measure. And it's about, well, at the median is 24 percentage points lower. Then there's also still a significant gap between the highest individual round food security prevalence in each country, right? And so this is this gap here between these two. And again, at the median, there's a 14 percentage points gap between these two. And we can compare this 14 percentage point gap. It's about the same size as the gap between the lowest food insecurity in a single round to the highest food insecurity in a single round. And so this difference between the highest food insecurity measured in a year and the lowest, this captures some of the transiently food insecure households, right? But the fact that there is still a pretty big gap between the highest and this longitudinal measure tells us that there is still a significant share of transiently food insecure households that are missed in these standard ways of cross-sectional ways of measuring food insecurity. And this is probably because, you know, they have these idiosyncratic food insecurity episodes that don't align with average peaks or during the year. Okay, all right, I need to hurry up a little bit. So now we're trying to look a little bit closer at the relationship between food insecurity severity in a single point in time and the duration of the food insecurity spell. So this graph basically shows for each fierce raw score the share of each food insecurity type, right? So if we focus in here on fierce raw score 0, this is the lowest. So here we have 70% of households that were observed to have a fierce raw score of 0 at any point in any round are never food insecure, right? And about 30% here in yellow that have this observed to have this score are transiently food insecure. What do we learn from this? I think one thing that I wanted to point out is that transient food insecurity is not necessarily mild, because we still see here at these very high FIA scores, which indicate high food insecurity severity at a certain point in time, still around 30% of those households are transiently food insecure, meaning that in other rounds they will have food insecurity scores around here, right, under 4. Then in the paper we just run a simple regression to understand relationship between the Fierce raw score and how well it explains variation in the time spent in food insecurity. And we see that this Fierce raw score is really not a very good predictor for how much time a household will spend in food insecurity. And so the conclusion is that depth and or severity and duration are empirically distinct dimensions of food insecurity. And so why does this matter? It matters again because we cannot really substitute one for the other. So the fact that cross-sectional data is not well suited to capture this large group of transiently food insecure households remains since we cannot substitute a severity measure for a duration measure. Okay, so next I'm showing you the profiles, the household profiles of the transient and versus the chronic households. So on the left are unconditional means of sort of standard household characteristics. On the right, this is a multinomial logit. And so the one thing that stands out here immediately, you'll see these dark blue dots of the never food insecure group. Here, for example, they're always quite far away from the other two. So they are distinct, empirically speaking, on household characteristics. These never food insecure households are wealthier, they are more educated, they're smaller households, and they're less likely to be female-headed. But the chronically versus the transiently food insecure households, they look quite similar on targeting relevant observables. So I don't think we can significantly tell them apart on many more than maybe one or two dimensions here. And so, yeah, one of the implications, as we're starting to move a little bit more towards thinking about the implications of this for policy, is that standard proxy means tests that often use these kinds of wealth indices and other household characteristics. From what this looks like, they cannot really be used very well to distinguish these two different types, or these two different groups. Now we look at geographic clustering. So we've looked at household characteristics. The next, thank you, thanks, sorry. The next bit is geographic clustering. This is from a multi-level model, and the graph shows intra-cluster correlation at different geographic and household clusters. So basically, those two dark blue areas here are geographical clusters, and so we see for this group of the never food insecure and the chronically food insecure, the district and village explain quite a lot of the variation. So there's quite a lot of clustering of these two groups. Basically, there's some clusters that are heavily concentrated amongst never food insecure household, and there are some clusters that are heavily concentrated amongst always food insecure household. Then, if you compare that to the transiently food insecure, there's very little clustering going on at these geographical levels, and the same holds for the household, right? So this just means that there is a fairly high level of persistence in the never food insecure households and in the always food insecure households through time. Whereas again, for these transient households, there seems to be much more changing throughout or over the course of the years. Okay. The conclusion that I put on the slide from this is that the spatial concentration of chronic food insecurity reflects the geographically clustered nature that we've also found for structural poverty. And so this is the point that I want to carry forward to this exercise, where we are simulating geographic targeting of chronic versus transiently food insecure households. So The idea here is that we are simulating a policy that selects the most food insecure areas, right? And delivers aid to all households within these areas, and we're using this cross-sectional FIES data as to rank the areas. And so basically here on the x-axis we have the share of admin 3 areas that would be targeted by this program, and then here is the share of the population of each household that we would want to target. And so what we see, I've drawn in here, like if we target the bottom quintile, this area targeting does a pretty good job for getting at the chronically food insecure households, right? So we get 40% of chronically food insecure households and only 5% of never food insecure households, which is a pretty good information advantage that this geographic area gives us. But for the transient households, we see again they are sort of around this middle line here, meaning that there is very little advantage in doing any sort of geographic targeting in trying to get at them. Okay, so let me start with some implications for, I'm out of time. Some implications for data and monitoring systems. I've said this a few times. Basically, identifying transient versus chronic food insecurity in real time requires high frequency longitudinal household tracking. This is not really a standard practice in the large food insecurity monitoring tools out there. And why do we care about this? Well, it matters really only if we believe that these two groups should have different policy responses, right? Where we have the sustained structural support for the chronic and timely shock responsive assistance for the transient households. And the implications for targeting, or the conclusions for targeting, is that these area-based targeting reaches the chronically food insecure households quite efficiently, but offers little advantage for the transient. And maybe let me just close on this last point, that what we have in the discussion of the paper is that there are these adaptive social protection systems that are being discussed now, that integrate high-frequency data, early warning, social protection, and disaster risk management. And this might provide a more productive operational framework for reaching these transiently food insecure households. Okay, thanks.
Thank you so much, Philip. Very, very interesting paper. I have some things here. I'll quickly go through. I know I have 5 minutes to discuss, but if I can't go through, I will send them to you. But I think this is a very interesting paper. Things that really stood out for me is, one, the conceptual clarity. So I think the paper is especially strong in clarifying that food insecurity is not the same as severity, but as well as duration. He also made the point that persistent deprivation call for fundamentally different policy response. So I think that is really interesting. I have a few questions for consideration. One is on the measurement and panel structure. You know, the paper made the point that irregular interview spacing and unbalanced panel were highly, you sort of highlighted this in the paper. And you also make the point that the more within-year observation could mechanically increase the likelihood of observing switches from either transient or non-transient. So my question is, how sensitive are these typologies, for example, to, so for example, if you fix the number of rounds per household or restrict the number of analysis to a set of months, how does that affect your result? Maybe something to think about. Another point I wanted to mention is on interpreting why severity is a poor guidance to persistence. I mean, it's a very good point you've made, that severity may be a poor guidance to persistence, but the question is, what do we do? Policy interventions sometimes respond, especially targeting, response to severity. So could there be, do you have other measures? For example, could you, for example, show, even descriptively, how often transient household experience severe food insecurity? How often do they experience food insecurity? If this is something you can also look at. Again, I also have question on targeting based on observables. You did find that observable clearly differentiate never food insecure household from ever insecure, but no differentiation from chronic transient food insecurity. So I think from a policy perspective, this is a very stark result, right? So perhaps you could consider looking at this further. So for example, could we do like a more frequent reassessment or linking household history to delivery system? Would that give us additional insight? I also have something on the geography and adaptive system, but again, like I can share. Let me just quickly make like few suggestions before I leave. First is it may be helpful to add a standardized frequency robustness check. This is in line with my first question. Okay, there's the different household are experiencing. So, for example, if you recompute the within year typology using a harmonized schedule, like a fixed number of observation per household per year, how would that affect the result? So, secondly, could you consider extending the geographical targeting simulation with one operational metric? That is something to also consider. And then possibly the third thing I wanted to add is it possible to add like a lightweight predictability exercise to support the adaptive system argument, which I think is very interesting. But again, I have things written up here I could share. I don't really want to take time so that we can maybe take other questions. But just to say, a very nice paper. Thank you very much.
Thanks so much, Godstime. I'll just respond quickly and then take questions. So I just wanted to say about the measurement and the panel structure. I actually I had another slide on this, but as we see, it was a good idea to drop that. So in a way, obviously, if you asked every household every day their food insecurity experience, probably you'd get almost everyone would be transiently food insecure. This is the thing that's conceptually a bit troubling about this, right? Empirically, the findings are super robust against doing all sorts of different exercises in defining different cutoffs, standardizing, normalizing, controlling. And so this general pattern will persist. And thanks so much. The other comments are super useful. So please do send me this. I'll incorporate this. Go ahead.
Yeah, super cool. One of the things that I think you're really well set up for would be seasonality in the various different countries. You've got, I think, 5 or 6 different countries. They have different rainy season patterns, different harvest seasons. Some do 1 planting season, 2 planting seasons. I think kind of spelling that out, there's probably some really cool graphs you could show us, kind of a bit like you've done the spatial decomposition of like, okay, how predictive is the lean season, et cetera, for these things, and how much food security is there that we wouldn't expect just from what we know about seasonal patterns in lean season, stuff like that.
Yeah, I'll answer this. Thanks. This is a really good, a really interesting point. We tried actually to use seasonality to predict food insecurity, and it does predict, but maybe a bit less than we were hoping. I also don't think we have the kind of, like, you have this really nice data in Malawi, right? That's almost monthly or even better than monthly. We have it a little bit more sporadic. So sometimes we're not perfectly powered to do this, but it's definitely worth adding in the paper. Because I do think that these sort of very high food insecurity rounds align with the lean seasons, for example. Yeah. Thanks.
Hey, I was just curious if you had tried looking at the percent of transients that potentially is explained by measurement error. I know that's obviously hard to do, but it strikes me like 8 questions, if you answer it slightly differently in different times. I'm sure you've thought about it, but can you actually measure that in any way?
Yeah, so absolutely is a very important point. And yeah, there's certainly a bunch of measurement error in this. One thing that we've done is that, they're supposed to be, in principle, kind of an escalating scale, right? So if you say yes to the first to the second question, you should have also said yes to the first one. In principle, it's like that. So I think we've excluded cases where it's, let's say they say no, 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 but then yes for one of the more severe items. That's obviously not a perfect test, but the patterns still look like what I've showed you when we do this.
Hi, Phil. Thank you so much for this presentation. It was very good. And I mean, thank you to all the team that working on this paper. So I think that this is a great paper, like positioning itself on the literature that is questioning the reliability of FIES. And I think, I don't know if, I haven't read the paper yet, but I don't know if you have discussed, so you mentioned the clustering issue, so the fact that actually there is a clustering effect. So I don't know if you ever thought about including like spatial weights in the calculation for FIES. So the fact that I'm close to someone with food secure can basically modify my probability of being a transient food insecure with respect to the chronic food insecure person, and given the granularity of the data that you have, if you run some prediction models in order basically to calculate, okay, if I'm food secure now and I'm basically have these characteristics, I'm positioning here within this cluster of people, what is the probability that this is going to be a transient food insecurity with respect to a chronic food insecurity? But again, I think this is super, super interesting, and thank you so much for this. I'm very curious to see, the upcoming work on this. Thank you.
Yeah, thanks so much. I'd be happy to talk about how to do this. I know that you do this a lot, and I don't know, I wouldn't know how to go about it. But yeah, thanks a lot.
Thanks. As everybody, I also find it extremely interesting, both data and analysis. But I then wonder, this may not be possible, but to what extent could the data be further used to inform on sort of, so the point at which transient food insecurity becomes a priority for policy, right? Because as you said, in parts of the world, if you were to interview people daily, you would find that everyone is food insecure, and the fact that it's transient definitionally means that it was resolved somehow, right? But maybe at quite big cost, so whilst it's unambiguous that chronic food insecurity is a great policy priority, and the elements of transient food insecurity are, not all is. So then I think, okay, well, what could be elements within your data that could look at this? One thing that is this severity, so not just exploring transient food insecurity overall, but looking specifically at the most severe cases, and if the results for your predictors hold also or if they're more systematically predictable. The other thing would maybe duration, and I don't know the extent to which the questions in your survey can inform on that, because there is an automatic element to this, which is that you advocate this sort of integrating higher frequency data and more warnings and such like, but the more high frequency collection techniques you employ, the higher incidences of transient policy you're going to find, right? So there has to also be some guide at which the importance for policy hits. Thanks. Sorry for the long question.
Yeah, no, that's fine. I mean, so I agree that it's a bit dissatisfying conceptually that it's sort of the bounding case, the extreme case is everyone is transiently food insecure. I don't know exactly how to resolve this. I think that empirically it will, like in the real world, it does matter, this distinction. And I think this question that you're raising, which basically, do we actually need to care about the transiently food insecure household, is a good one. Right. Yeah. I mean, I think maybe we can be a bit more specific about what happens, right? Because I imagine that, for example, if the thing that we might really want to avoid is a household having a bad idiosyncratic shock, then dipping into food insecurity and maybe staying in food insecurity, right? Like these are cases presumably where with it will become chronic, right? But we'll observe them as transient at some point. So I think this is a concern where, like, with a lower investment, you could probably help this household back out of poverty. If, for example, if we follow the narrative that Godstime laid out earlier. I think we're over time, so I'm happy to answer more questions, but I don't want to hold everyone hostage any longer. Thank you.